everyone, welcome back to my channel. My name is Clarynda and I'm a labor delivery nurse here to talk to you about how to advocate for yourself in the hospital during your labor and delivery experience. So according to the CDC, 20% of women report mistreatment in a hospital setting during their labor and delivery experience. These interventions include epidurals, rupture of the water bag, and inductions of labor that are usually not necessary and are not medically indicated. So today I want to give you guys 4 tips that you can use when you're in the hospital, either for yourself or your family member that can advocate for you when you're unable to do so. So tip number 1, you want to know your rights and preferences. As a patient, you have every right to know what consents you're signing, what paperwork you're being brought to. You have every right to know what procedures are being done, what medications are being administered to you, and you also have the right to have your own preferences. Of course, having a birth plan is great, and with me working in a hospital, sometimes the birth plan does not go as planned, and sometimes other avenues have to be explored, such as an emergency comes up or your birth plan doesn't go as planned. Then, of course, you can navigate through that in a different way. But the basic knowledge of what you need to know as for how to advocate for yourself is to know your rights. You do have a right to know what you're signing. You do have the right to know what procedures are being done to you and to your baby. Procedures such as rupturing your water bag, making sure you have consent to that and that the doctors are explaining that thoroughly to you. Some doctors will use the term, I'm going to help your baby or help your labor progress faster, which usually means you want to rupture your water bag. That is something that you really need to educate yourself on. Either if you're not able to in that moment, you can have your family member do that for you, just so you know that that does come with consequences sometimes and can lead to more interventions. So interventions such as inductions of labors, which is usually something that the doctor will tell you on your office visit that you need to have scheduled due to your due date approaching or because of gestational diabetes, which can be a reason for induction. If it is requiring you to be on insulin and it's not diet controlled, then there is a reason for that, but that's another topic that we can dive into along with preeclampsia, because those are 3 separate topics. But in general, and if your doctor's telling you that you need to be induced, it's something that you should really ask further into. And also just to realize that a due date does go to 44 weeks. That's usually how long a mother can be pregnant for, is 44 weeks. And 14 days after that, you're considered overdue. So a lot of doctors will want to induce you around 39, 38 weeks, usually out of convenience. So that's tip number 1. You really want to know your rights. You are usually giving paperwork when you are first admitted into the hospital regarding your rights and your privacy. And it also, in our hospital, we at least let the patients know that if they feel they're uncomfortable with the situation, that they're able to speak up, that they're able to voice their opinion to their nurses, to the doctors. And if that's not addressed, then there's other solutions that they can use to be able to get their voices heard. So tip number 2, you want to be able to communicate with staff effectively. Communicating with them thoroughly, clearly, making sure that the things that you do want done during your labor delivery or your preferences are very important. You can have them written down with a birth plan, and sometimes the birth plans don't always work, or sometimes you have to navigate around a birth plan, but it is important to know how to communicate effectively, clearly, and calmly to your staff. This also goes for your doctors. When you're in your doctor office visits, you're speaking with them regarding your care. You want to ask certain questions. How do they handle inductions? How do they handle labor? Are they okay with the natural process of labor and not having to rush things and speed things up? And if you do not want things sped up and you want things to happen naturally to prevent further interventions from happening, you want to communicate this to your doctor and to your nurses. And that is something that every healthcare provider should be able to acknowledge. It's that birth is a natural process and it does take its time. And unfortunately, in the healthcare system, things are done very fast and rapidly, and we want to get things done quickly. So medicine and interventions and inductions are very frequent. So 1 out of 4 women in the United States are induced, which is a very high number. It's telling us that we're not taking our time and having natural birth experiences in the hospital. So tip number 3, you want to be able to involve your support system. This kind of coincides with everything as far as how to advocate for yourself. You want to have your husband or your spouse, whoever is there with you, your mother, grandmother, family member supporting you, to be involved with the healthcare system too. You want them to be able to speak up when you're not able to. If you're in contractions or you're having pain, you're not able to voice your opinion, or you might get a little bit of a brain fog. And of course, labor is very intense and you're not able to think clearly at all, let alone try to voice your concerns or what you prefer. So it's really important to have your family member there to be able to speak up for you when you're not able to. So going over your rights and going over your preferences with that family member before you enter the hospital is a really good idea. You can also write your preferences on what we call a nursing board, which is a communication board in every single room. You can go ahead and list the things that you prefer, what you don't want done, just to have a reminder. If you don't want an epidural, you want to post that on your communication board. Unless you have a safe word you want to use and the pain is unbearable, then you want to make sure your spouse or your husband is familiar with that safe word. And just also be able to have your loved one educated on birth and hospital settings, attending a birthing class together, or attending any type of educational program will be really beneficial for you and your spouse to be able to support you guys during your labor and delivery experience in the hospital. And tip number 4, which is also very crucial for being able to advocate for yourself in the hospital to have an empowered birth experience, is escalating your concerns. If you feel like you've gone through all of the tips as far as knowing your rights and preferences and expressing those concerns to the staff, and you're communicating thoroughly, you're involving your support system, the last step is usually escalating it up to a higher authority in the hospital setting. So let's say, for instance, you don't agree with the doctor's decision to want to use a vacuum on your baby to assist with delivery. And this is usually a pretty tough decision because that means your baby is exiting the birth canal and you're seconds away from delivering the baby. You can always voice those opinions to a nursing manager, a nursing supervisor. The Joint Commission of Nursing is also another higher up authority that you can address your concerns to in the hospital. This is, for instance, if you're not able to get through to someone higher up during a critical situation that's happening right away, you can always call the Joint Commission phone number after your experience, but hopefully that doesn't happen and you're able to fix the situation before something escalates even further. So if your nurse is not able to address the situation and then your doctor's not listening, there's a manager on the floor that usually is able to help you out during the day. And at night, there's a house supervisor that is usually in control of the entire hospital during the night shift. And of course, if that doesn't fix your situation or you do not feel like your voice is being heard, then you definitely want to go to the medical board, or you can go, like I said, to the Joint Commission, and they're great with answering phone calls and really hearing your concerns, because these issues need to be addressed to be able to have women to have a great birthing experience along with their fathers, to be able to feel comfortable in a setting and to have their voices to be heard. It's very crucial and critical during such a vulnerable state of parenthood. So delivering your baby in a very safe, healthy environment is important, and advocating for yourself is crucial, and it can make a big impact on your birthing experience. So I hope these tips were helpful for you. And if you want to comment below and we can open up a discussion about how to advocate for yourself, maybe you can share some stories on what helped you to advocate for yourself or what did not. That would help everyone out just to be able to have a great, empowered birthing experience. Thanks for watching this video, and I hope these tips were very helpful.